This conference will now be recorded.
Excellent. So we're going to continue with understanding Alzheimer's and dementia, caring for the individual. And we're going to talk about some brain changes. So I want you to look at the differences in this picture, the healthy brain versus the advanced Alzheimer's brain. And there'll be numerous things that you'll notice. Probably the thing that strikes you first is the size of the brain tissue. We mentioned that Alzheimer's disease, there's brain cell death. So the tissue is dying and it's shrinking, and we're seeing a change in the size. We're also seeing larger spaces in between these sulci. So these spaces are much greater. If you were here in my training room here, I would be handing you 2 bags, one with 1 pound of rice and one with 3 pounds of rice, and you would hold those in your hands. And if you have an ability at home to take maybe a 1 pound can of soup and put 3 cans of soup in another bag and hold those, you're going to feel a dramatic difference in the weight. And that's representative of what we see on autopsy in the brain of a healthy person, somebody who died basically with a healthy brain, something else killed them, is about 3 pounds, versus on autopsy, the brain of somebody with Alzheimer's disease is 1/3 that size, or 1 pound. So we'll notice what we'll talk about today is 2 risk factors for Alzheimer's disease. So we're talking about, again, putting together those brain changes with what's really going on here. And so we'll talk about 2 risk factors. We'll recognize the name of the filing cabinet that stores new memories. You'll identify the part of the brain that relates to basic emotions, and lists 3 stages of Alzheimer's disease. And as we go through this, let's not lose track of that picture of the significance in that brain tissue. So what are the risk factors for Alzheimer's disease? One thing that we know is that there are plaques and tangles building up in the brain. And we know that these are related to 2 different proteins. One is called tau, and that's creating these tangles. And one is called beta amyloid, and that's creating the plaques. So researchers are still trying to figure out the underlying cause for these plaques and tangles. One thing we do know is that even a normal brain has a little bit of plaque, a little bit of amyloid building up, but we have this gone haywire in somebody with Alzheimer's disease. We now know that somebody with Alzheimer's disease, these plaques are building up beyond normal as much as 20 years before we'll see any symptoms at all. So what are the risk factors? Let's see if I can get this to progress. Increased age. So I mentioned that increased age is a risk factor for Alzheimer's disease, but it is not a determinant factor. We don't get Alzheimer's disease just because we're getting older. It is not a normal part of aging, and it's important for us to remember that. But it is the greatest risk factor. So the older we get, the more likely we'll see somebody have Alzheimer's disease. And they think that accounts for why we're seeing so much more Alzheimer's disease now in our population. 1 in 10 people over 65 will be diagnosed with Alzheimer's disease, 1 in about 7 over 75, and over 1 in 3, almost 1 in 2, but not quite, will be diagnosed if over 85. Almost 1 in 2, really over 1 out of 3 people. So age is certainly our greatest risk factor. Genetics plays a part, and it's important to know that there are risk genes, and then there's the deterministic genes. And that means that if someone in your family has Alzheimer's disease, it's not a given that you will have it just because they have it, but genetics can influence our risk. These risk genes increase our likelihood of developing the disease, but don't guarantee it will happen. There's a gene called APOE4, which is the first risk gene that's been identified, and it remains the gene with the strongest impact on risk. And then there's the deterministic genes. And these deterministic genes means that there is a direct cause for the disease, guaranteeing that someone will inherit the disorder. These are rare genes. Only a few hundred extended families worldwide have been identified, and they account for less than 5% of Alzheimer's disease. Usually these are in the younger onset Alzheimer's disease category, much higher genetic connection there, more likely a deterministic gene. There are other risk factors as well. And these include, things like whether we have a cardiovascular history, if we have a very sedentary lifestyle. Things like diabetes, obesity, smoking, and hypertension are increased risk for dementia. Our diet is also, the healthier our diet, more Mediterranean diet, nuts, olive oil, high fish, low red meat. These are considered a brain healthy diet, decreases our risk factor for dementia. Remaining socially and mentally active throughout life is very important to reduce our risk, and also reducing our risk of traumatic brain injury. So minimizing risk of falls and any hits to our head is important as we try to mitigate risk factors. So let's talk about the progression of the disease. Often one of the first symptoms is a short-term memory loss. And short-term memory loss is the part of our memory that thinks it accounts for just what we've just learned, things that have been learned recently and not reinforced to the point where they've been moved to a different part in our brain that would be considered long-term memory. So if you are looking up a phone number to order pizza, you will remember the number long enough to dial it, maybe for a very short while after. But it's not until you're ordering pizza maybe once a week for quite a long time that you'll have that committed to memory, and you won't forget it if you don't order pizza for a long time. I still remember my childhood phone number. That is long-term memory, but I'm not going to remember ordering the pizza from down the street because we don't order it frequently enough. And we're going to remember that just long enough to punch that number in. So short-term memory is what's being affected here. Most in the early stage of the disease, we have seen to short-term memory loss. And we'll even see folks who don't remember eating a meal that they ate very recently. And again, this is one of the first symptoms that we notice. Frequently we'll have a frequency of questions, re-questions. What time is it that we're leaving? What time is it that we're leaving? What time is that we're leaving? And that's because your answer is not getting stored because short-term memory loss is affected. So there is a specific part of our brain that's responsible for short-term memory, and that's called the hippocampus. And the hippocampus is this purple structure here that kind of wraps around, and it's responsible for taking in new information, comparing it to everything else in the brain, and labeling it and storing it. So it is like our brain's filing cabinet, and it takes in new information that you want to remember. So to remember someone's name, your hippocampus puts it in your filing cabinet so that you can retrieve it later, okay? And when the hippocampus is breaking, it would be similar to having a secretary work for you who can never remember where any of the files are, can't make an association with any of the information that's coming in, so nothing gets filed and you never can find anything. So what is going on for somebody with Alzheimer's disease who can remember things that happened many years ago, but not something that just happened? Well, as I said, as information comes into and is compared and labeled and then stored, eventually it's stored in a different part of our brain that's responsible for long-term memory. And that part of the brain is lasting a lot longer than the hippocampus. So in the early stage of the disease, the first things that we see damaged is that hippocampus. It's important to know that eventually all areas of the brain are going to be affected by Alzheimer's disease. Those amyloid plaques and those tau tangles are affecting all aspects of the brain. It's just that we see it first in the hippocampus. So again, it takes in new information, compares new to old, labels and files that information, and then with Alzheimer's disease, that's the area that's impaired first. So there are stages that we talk about with Alzheimer's disease. And in the early stage, we're going to see things like, again, for short-term memory loss is affected. So we get a lot of repeating or forgetting information. Depth perception is changed. So we may see difficulty with judging distance. And I described that person riding in the car who thinks you're speeding because the distance from the side of the road or the tree or the telephone line or the intersection is coming to them in a different manner. We're going to find word finding and following conversations difficult. So we'll see word substitutions. Somebody still seems conversant, however, they're not quite following the theme of the topic that you're talking about. They may begin repeating topics, going to stories that feel safe to them, that they feel that they can have a conversation about, but it's repeating stories. We see some fine motor skill difficulties, so maybe buttoning buttons is beginning to get difficult. And they may make an excuse, oh, no, I just want my shirt open like that. Difficulty with complicated tasks, things like paying the bills, following a recipe, balancing a checkbook. We see those things start to be avoided, or they think that they've done them when they haven't, or problems with them, forgetting entire parts of a recipe but going ahead to bake it anyway. Trouble planning and organizing, so certainly planning a family activity. Maybe we see someone who always hosted the holidays now refusing because it's overwhelming to organize something like a gathering. And then lack of initiative and a change in attention span. But oftentimes in the early stage, these are people who are functioning independently. They're still getting up, getting dressed, getting bathed, putting on makeup, doing their hair, and some will even pass a driver's test. So day-to-day function looks pretty good. You've got to spend a little bit of time with these folks and you're going to see where the problems are. By the time we get to the middle stage, we see increased forgetfulness. Verbal communication is changing significantly. Word substitutions that don't make much sense at all. Getting stuck on certain aspects of something, not being able to say, we need to unload the dishwasher, but maybe it's, we need to do that, we need to do that, we need to do that. Personal care and other complex tasks are getting affected. So we may see someone who's wearing the same clothes over and over, maybe avoiding showering. That's a very complex task. It can feel threatening, so we see avoidance of that. Vision and movement are definitely becoming more impaired. We see a change in comfort moving around unfamiliar places, and maybe even beginning to see some shuffling and of feet. There's a disorientation to place and time. Somebody who may not believe they're in their 80s, but think they're in their 50s. Not certain if they're in their own home because they're thinking more of the home they lived in previously. There's a lack of insight and awareness. In this stage, we definitely find people who were aware that they were diagnosed with Alzheimer's disease in the early stage and can talk about it and have insight about it, how it's affecting their life. By the middle stage, they no longer are aware they have this disease. They can oftentimes be insulted that somebody thinks they're having problems. It's a very scary stage because life seems so unpredictable. They're not remembering what's going to happen next. So we see some emotional outbursts, and we can see personality, mood, and behavior changes. And then in the late stage and final stage, we see an overall decline in health. We're having eating and swallowing issues. So we may see more aspiration of liquids and foods. So we're more prone, more susceptible, certainly, to things like pneumonias. There's very limited verbal communication. Maybe they can sing along to an old song and suddenly remember all the words, or out of the blue, after not speaking for a while, they say their daughter's name. But this is kind of those once in an instant moment and not something reliable. We're seeing incontinence, and folks in the late stage are going to need full assist with their activities of daily living. That's being fed, getting dressed, getting bathed, how they get out of a chair, toileting, and again, their incontinence. They're going to be unaware of recent experiences and their surroundings. We see that this is a stage where people are very sensory driven. So if we are angry and frustrated, they're much more likely to pick up on the sensory information we're giving them with our increased rate of speaking, maybe our change in tone if we get loud, versus somebody who's very calm, loving, peaceful, serene. They're going to be very in tune to that. That's how they're going to learn about who someone is. Is this a safe person? This person makes me feel calm and comfortable versus the person who makes me feel frustrated and upset and angry. We see weight loss because there is a change in the way eating and swallowing is occurring, and ambulation ability may change. So we have some people who may stay ambulatory towards the very end of life, and other people I've seen who have become wheelchair bound earlier on in the late stage and are wheelchair bound for quite a while. Certainly the people who are remaining ambulatory may need a walker or hand holding to stay safe because of significant vision changes, significant control of movement changes. So let's talk a little bit about emotion and the amygdala. We talked about how the hippocampus is being affected and it is shrinking in size. One of the things we know about the amygdala is it is not changing. And so people, the amygdala is the place in our brain, it's this small red nut size thing there, lima bean size maybe thing there. It is the place where we feel basic emotions, including fear, anger, and love. And with the amygdala, it is not deteriorating. So even into the late stage of the disease, our people diagnosed with Alzheimer's disease are going to feel those emotions of love as well as anger, and that's why our emotion makes such a big difference. They're going to perceive the emotion of others. They very well can express emotion and hold on to strong emotions. And just like when we feel somebody's emotion, but we know they got stuck in traffic and maybe they had a tragic event in their life recently, they lost their job, they're under a lot of stress, and they come in to have an exchange with us and they are upset, we can rationalize, oh, she's upset, she's going through a lot. With somebody with Alzheimer's disease, they cannot rationalize. So if we are coming in with strong emotion, they're going to pick up on that, not be able to rationalize it and hold on to it. And again, that's why our emotion is so important, because they cannot transition beyond it very easily. So what treatments are available to Alzheimer's, to folks living with Alzheimer's disease? Currently, there are not really any medications that are helpful except to treat some of the symptoms. So if someone is having significant hallucinations or sleeplessness or anxiety or depression, we can treat those symptoms, but there's not much we can do to treat the disease itself or the progression. There are some medications that people are prescribed and taking, and you've heard the names, Aricept, Namenda, but they are not finding that those are very effective. Certainly, they are not slowing the progression, they're just masking the symptoms. So non-pharmacological treatments become very important, and that's the focus of most of this curriculum from here on out. And it is important that we remember that as we look at non-pharmacological approaches and the way we enter into an engagement with somebody with Alzheimer's disease, that we remember that they are holding on to our emotion. So our own emotion becomes very important, how we stay calm and look at what their abilities are, their strengths, and what their weaknesses are. We can't depend on them to remember that we just told them something. So we're not going to say to them, I just told you we're going this afternoon. We're going to say something like, yes, it is a beautiful day, and I can't wait till we go for ice cream this afternoon. So we're not going to hold it against them that they can't remember, and we are going to use positive, calm, and kind words to reinforce what we need to go, the direction we need to go. So what did we talk about today? In this section, we talked about risk factors. And the number one risk factor is increased age. Genetics does play a role, and there are risk genes and other risk factors and deterministic genes. We talked about how the hippocampus is the filing cabinet of the brain, and with Alzheimer's, it is impaired. We talked about stages of Alzheimer's disease, early, middle, and late stage. And we talked about how the amygdala is the part of the brain that is registering basic emotions of fear, anger, and love, and how this part of the brain is not deteriorating. And even into the late stages, our clients with Alzheimer's disease will perceive emotion, express emotion, and hold on to strong emotion. So let's see what you've learned, and you can go ahead